like with any medical test, you're looking at the risk of the test and the benefits that you're going to gain from it. And most people believe that if there are any risks of ultrasound, they're so minimal, and the benefit that you're going to gain from the knowledge that you get from the ultrasound is outweighed by any potential risks.
What are the benefits of ultrasounds?
You use them to document fetal viability. You use them to estimate, or not estimate, to identify the number of fetuses that are present. You identify the amniotic fluid volume. You locate the placenta. And then you look at the size of the baby to make sure that the growth is normal. And at around 20 weeks, around 18 to 20 weeks, you can evaluate many of the fetal anatomic structures and make sure that all the fetal anatomic structures are developing normally. So basically, you can use it to assess a variety of different potential fetal problems.
Okay, but structurally mostly, right? I mean, you
Not all
can't tell
structurally.
genetically, can you?
No, you can't tell genetically without a genetic test, but there are some structural anomalies or patterns of structural anomalies that are suggestive of a genetic syndrome that may lead you to do testing for that genetic syndrome if you see a certain constellation of ultrasound findings.
Like what?
There's a disorder called Beckwith-Wiedemann. It's associated with a large baby, a tongue that protrudes out. So if you see a large baby, a tongue that's protruding, you may think about that. Something called Meckel-Gruber syndrome. Their kidneys have cysts in them, and you can have a neural tube defect. So if you see that constellation, then that may tip you to go and recommend invasive testing to definitively diagnose the syndrome.
Are there any treatments prenatally for those?
There are some disorders that are amenable, or you can improve outcome with prenatal treatment. But many of the disorders, no. It's just having the diagnosis but it does give you the opportunity to learn about the disorder, make decisions about how you want to manage your pregnancy, and there are some disorders for which intervention right at the time of birth is important. For instance, a cardiac defect. There are some fetal cardiac defects that need to be addressed immediately. In other words, the baby needs to be taken from the delivery room to the operating room. Waiting time is going to increase the chances of compromise.